Okay, so you can see my screen that says other blood test?
Yes.
All right, cool. Okay, yesterday we talked about a ton of different blood tests, and we were going through the more specific test, like they would not just a generalized overall, but when they want to look specifically closer. We talked about glucose, right? And the hypo versus hyperglycemia. And then now we're going to move on. We'll talk about what they call BUN. And BUN stands for blood, urea, nitrogen. And this is something you'd want to know, you'd want to remember, and you can write it down, flashcards and so forth. What does BUN do? BUN basically is another test for the liver and the kidneys. I like to think of the BUN as it's checking your filtering systems. All right. It's letting you know, as a healthcare provider, how is this person's liver functioning? How's their kidney functioning? And when we see abnormalities, we can pretty much start pinpointing it down to, okay, it's this, or this. We do not want high BUN levels. This usually, what the common thing is, if you have a healthy person and they have high BUN levels, the first thing I'm going to go to is dehydration. All right, because I'm not going to think of, some young healthy person having a myocardial infarction or heart failure. But those are all signs of high, abnormally high. Another thing that's very common nowadays is this high protein diet, or what they call the keto diet. It does cause elevated levels in multiple different blood tests. So that's always one of the first things that you ask is, are you doing any dieting? Are you like specifically keto dieting or something like that? Because that extra amount of protein does change their blood value levels, okay? Anything, this is the number, anything over 100 is critical. So should be reported to the doctor, okay? Lower levels of BUN mean that they're starving, okay? They're not getting enough protein, that they have a very poor diet. Very, very, very rarely do we see it because of overhydration. A case where you might see that is if you're working in a hospital and a patient's receiving too much fluids, IV or something. You might see it with liver disease and sometimes during late stages of pregnancy with people who are having preeclampsia and stuff. We usually run BUN in addition to other tests. So it's just another indicator and allows us to look a little deeper. The next test is creatinine. And what creatinine is basically, it shows us the waste product of your muscle and the metabolism. So anything that is excreted from the kidneys, muscle energy, stuff like that, anything that's waste that hasn't been processed out lets us know that there could be some kidney issues, okay? So this is a really good test to tell us how our renal or kidney function is. It is not used as an early detection. And once again, you're going to see when you have an elevated creatinine, it could be because of dehydration. It could be because of muscle damage. And then there's this again, preeclampsia. or eclampsia. So related, because we learned when we learned the urinary system how our kidneys directly coincide with your blood pressure and its levels. Okay. Another test that we might also run across, that's it's a routine test, is calcium. And remember, it's Ca. Calcium is vital for your neuromuscular. Calcium is vital for your blood coagulation. Calcium is also vital for cardiovascular and bone. And so calcium is a really important substance. And we see a calcium deficit in a lot of people. When we see it really low levels, this is a term you write down, it's called hypocalcemia. All right. And that's a level lower than 7. This should immediately be reported to the doctor. This is an emergency. Okay. So, a very important element that we have in our body, in its lowest form, we'd be calling hypocalcemia, and that's 7 or lower. Now, hypercalcemia, that's when you have extremely high levels of calcium in the blood. This is anything over 12. And when we normally see this is when you start seeing patients that are coming in with kidney stones. One of the things that correlate and go hand in hand is usually if you see a hypercalcemia, you are also going to see a decrease, usually in the patient's vitamin D level, because these two kind of trigger each other. So it may be their whole calcium is off balance just because their vitamin D level is so low. So it's kind of weird how it all plays together. And I said that because, my fiance, his calcium levels were high. We didn't know this. We found out because he went in with a kidney stone stuck in his ureter. And the whole reason after 24-hour urine testing and the surgery to remove it and all that, found out that he had extremely low vitamin D levels. And it's because of his recluse hermit lifestyle, not going outside, not soaking in the sun. So now he takes vitamin D supplements. So you'll see these two, this hypercalcemia and decreased vitamin D, a lot of times will go hand in hand. Okay.
Miss Scaffa, I'm gonna have to get off in a minute to get ready for the class at
That's
1.
fine, sweetheart.
Okay, but I'm gonna listen until I get ready.
Okay, I've been recording. And sodium, sodium's vital in our body as well. And if you remember back, sodium is capital N and lowercase a. And basically what sodium does is it controls the distribution of water. And you're like, huh? And think of it at a cellular level. It helps with, if you go way back into, 7th grade when you learned about, the permeability of water and how through cells and stuff like that. That's what sodium's job. It also assists with muscle contraction and nerve impulse transmission. So it's a very, very important element as well. And you could see if somebody came in having massive dehydration or massive issues, maybe with some type of metabolic syndrome, why we would want to see these individual tests and know what their numbers were. All right. A sodium level that is critical is going to be something that is less than 130 or more than 160. That's not a very big range, is it? So that's one of the ones that if it is out of range, it's very important, okay, that the doctor knows about it and that is made aware of it. We call high levels of sodium hypernatremia, and basically what we're going to see that from is a loss of fluids, a decrease in body water intake, or just way too much sodium in their diet. And hypernatremia is going to, as you can expect, like with dehydration and excessive sodium, it's going to affect the blood pressure. And it just depends on the reason behind it and the patient. You might see extremely elevated blood pressures, hypertension, or you could see hypotension, especially if it was loss of fluids and stuff. Okay. Your patients who have high blood pressure and who are told to be on a low sodium diet and this and that, they're some of our worst ones. They're the ones when we tell them, pardon me, to do this, that they're like, okay, I'll do that. And then they're still going home and putting salt on and everything. And then they wonder why when these tests come back, they're abnormal and the doctor's worried and sending them to specialists and so forth. And this is one of the reasons, because there's a very small variance of the numbers. Low levels of sodium are hyponatremia. This, because it's a water-based thing, is either a loss of sodium, right? You're not, losing sodium, not getting enough of it, or an excessive intake of water, where basically you're almost drowning it, so that your normal body sodium production and levels and stuff like that is not able to keep up with it, so it's being drowned. So that hyponatremia or hypernatremia, both of them are deadly. Both of them can be. So they're important to make sure if your patient does come back with these abnormal levels that they're aware of it. Potassium is another really important blood test that we run. And when I can't stress to you the importance of potassium. Potassium is K, all right? And here's one of the main reasons potassium is so special and important is this word right here, the heart. Potassium is what helps when those molecules, remember how we talked about the SA node and the AV node and the Purkinje fibers and all of that? Well, when they get those chemical signals, it's because they're also getting these, those chemical signals are being sent due to the potassium and the other elements that help the body maintain homeostasis and heart functioning. And one of your big ones here is potassium. Okay. The normal level for somebody who has potassium could vary slightly, especially if you see somebody who has a underlying heart condition or a known heart condition, something like that. All right. Abnormal levels are often asymptomatic, meaning that person doesn't even really realize that their potassium is either low or high because there's no symptoms. And so that can be deadly. Potassium level less than 2.5 or more than 6.5 Here's the first time you've seen this word, lethal. It literally can kill you. I have heard of, I watch all those murder mystery things, and somebody had taken a large dose of potassium and administered it to somebody, and that killed them. And you can see why. 6.5, something higher than that, that's going to mess up your heart, right? So when you think about potassium, I really want you to think about the heart and the electrical activity, okay? And I want you to think death if you see numbers, 2.5 lower or 6.5 higher. This is one of them tests, star it and mark it, that if it comes back abnormal, the doc needs to know about it right away, okay? And then with our potassium, when it is high, we call that hyperkalemia, okay? And when it is low, that is hypokalemia. All right. And both of them are from absorption issues. Okay. And both of them, either hyper or hypokalemia, is possibly deadly. Okay. You do need to know these words, these terms. Okay. Our next element we're going to be talking about for blood work is bicarbonate, or carbon dioxide, CO2. And the bi meaning two, right? CO2 is our waste product from our lungs, right? Everybody knows this. When we breathe in, we take a deep, big breath, we're breathing in oxygen, and then when we're letting out the waste products, and one of the big one is CO2. So why would we run a blood work for somebody to see their CO2? Because it tells us a lot of how that person's functioning. And this is where my paramedic life went to. And if you go into nursing, this is where you start pulling at your hair and crying and, curling up in little balls. When you start talking about the whole acidosis, it's a whole new level, and thank God y'all don't have to learn about it. But when your pH, and this is how we regard when your CO2 levels are low, we're gonna refer to that as acidosis. Okay, that's that, and that all goes back to the homeostasis, right? So acidosis is low blood pH, all right, and then alkalosis is high blood pH. And the pH is, our what's normal blood, like 7 something. So it's a direct effect of O2 versus CO2. And I'm trying to keep this as simple as possible. Respiratory acidosis and respiratory alkalosis both are deadly if left untreated. Respiratory acidosis means that there is not enough ventilation to the lungs, okay? And then when you see respiratory alkalosis, the high pH, that results from low CO2, but it's causing, because of that, a real high pH number. Don't worry about this part. Scratch it off. Just know that when we think of bicarbonate, all that means is CO2, okay? And we never want to see alkalosis, and we never want to see acidosis. We want that person homeostasis. We want their pH normal and balanced, okay? The next one we're going to talk about is chloride, Cl. Chloride is kind of a helper element, and I like to say because it works with other electrolytes, and it helps to maintain the fluid and acid balance. So like we were just talking about with the bicarbonate, and it also helps maintain what we call osmotic pressure, and that's the fluid pressure, okay? So chloride is an important test as well. This is produced by the stomach, and it's basically hydrochloric acid that helps with the digestion. So if you can see how when we're starting to digest things and we're moving things along, if we had too much, that could be a problem. Too little, that could be a problem. And that's exactly where these terms come in. And I've always stumbled with these. Hyperchloremia, oh, I think I said it right, is when you have too much in the blood. All right? Hypochloremia, obviously, is too low. So just try to understand these words when you're thinking, this is chloride, so chloremia, it makes sense, right? And just like, well, that's a really bad excuse, but just like the neutremia now I can't think of anything. Potassium's bad because it's K. Oh, okay, like sodium, Na, like hyponatremia, low levels. And so I was trying to give you something example, and I failed. When you see a patient whose chloride levels are either too high or too low, you're usually going to see this either high or low as well. These kind of are both tests that when you see one's abnormal, the other usually is as well. Okay? The next thing that we're going to talk about is albumin. First thing that should pop into your mind when you think of the word albumin is liver. Okay? This is a protein, and it is made in the liver, and it basically balances our liver and our blood. And it is very important with maintaining a healthy liver, a healthy kidney, and a healthy overall body. Hypoalbuminemia is when obviously it's too low. And this suggests kidney or liver issues. It also can because this person has some type of digestive issue and they're not absorbing enough protein. Okay? So I want you to go back to albumin and go back up here, liver, and then protein. Okay? Focus in on this word right here. So this person does not ingest enough protein, or the protein that they're getting is not being absorbed properly. So we see the hypoalbuminemia. So this also comes into play on its counterpart. And I want to jump. Are you really? I don't have hyper. Hyper, let me just tell you real quick. its opposite counterpart. We see that when people are on high protein diets, just almost without fail. Just they're really pumping up, bodybuilders, stuff like that. Their albumin levels might be elevated. Could it be other reasons? It possibly could. But this is the one we're really going to focus and worry about if we do see it really low. Okay. I got time for one more protein. Our total protein is a very generalized overlook. All right. This measures the overall state of the nutrition of the body. All right. It tells us this person is well fueled and this person is healthy, eating good, or this person is dehydrated, this person's starving, this person's not doing well. They use this when they're trying to maintain a person's caloric value, a person's who's on like feeding assisting or something like that. This is going to be a valuable test. It's also seen abnormal numbers when we have dehydration. I've heard of people saying that it's there's an abnormality with protein from excessive exercise too. I've never seen that. I wouldn't know anything about excessive exercise. And then okay, I said that was the last one, so we'll leave it with a funny joke. But the protein. So when you do see it high, usually the person's on a high protein diet. So that's it. And I hope you enjoyed lecture and learned something. And please make sure I'm going to be posting a couple of online labs after we leave this. Make sure if you are online lab that you are responding to these. All right. Y'all have a good day.